Today we are going to talk about a surgical robot. So when we talk about a surgical robot, there are three questions which come to our mind. Number one is, what is a surgical robot? Number two, why a surgical robot? And number three is how it works. So surgical robot is just an interface between a surgeon and a patient. So basically it is a sophisticated computer which is put in between the surgeon and the patient so that the outcome of a particular procedure gets improved. Now, why is a surgical robot? The question is exactly the same as, why do we have to fly from Mumbai to Delhi instead of traveling by road? Because there are various reasons. We can reach there early, it is convenient, and mind you, it is much safer way to travel by an aeroplane than by road. Similarly, on similar principle, a robot is used. So if we are going to achieve the similar kind of principles at the end of a patient's management, we have to use a surgical robot. So a surgical robot definitely helps in recovering the patient in much earlier than a normal conventional surgery. The blood loss is less, pain to the patient and the suffering is much less. And of course, it is the most precise way of performing a surgery in today's world. Now, the third question comes is how it works. And many patients, they ask us whether the robot is going to perform the surgery, but that's not true. The surgery is 100% performed by an operating surgeon, and robot is just going to be a medium between the surgeon and the patient. So let's talk about what are the different things which are involved in a robotic surgery. This is the state-of-the-art daVinci Xi system, which is the most latest version of the daVinci system. Typically, a surgical robot has got three components. It has got a patient cart, which actually operates on patient's body. This is the vision cart. The vision cart is a processing unit of the robot and a surgeon's console, from where the surgeon would be operating the surgical robot. Now, we at PD Hinduja Hospital have actually acquired a robotic table which is also called as a trump table. Basically, this table would be paired with the surgical robot and it will be talking to the robot as the surgery is underway. Therefore, during the surgery, if we have to change the patient's position, we can do it simultaneously by moving the table and the surgical robot together, which helps the surgeon in saving the time of the surgery, as well as it is extremely convenient way of performing the surgery. So let's talk about how it functions. Now, as I have told you, there are three main components of the robot, and this is the patient's cart, which gets attached to the patient's body. What we'll be doing is, we'll be using tiny cannulae. These are like small tubes which are inserted in patient's abdomen. This robot has got 4 arms. One of the arms is basically surgeon's eyes and 3 arms are performing the surgery. So this is the first advantage of a robot. A surgeon has got 2 hands, though we have got 10 fingers. This robot has got 3 arms. Each arm will have a rotating movement which is more than what my wrist will do. My wrist will have a 360 degrees of motion, but this robotic arm may be able to perform up to 560 degrees of movement, which is like this. Each of the arm has got multiple joints, and these joints are enabling us to make the robotic movement in any nook and corner of the patient's body. Now let's talk about the vision cart. As I mentioned you earlier, vision cart is the main processing unit of the robot. It is the brain behind the robot. But it has got various components, such as it has got a high definition television or a monitor which displays the interior of the patient's body. It does have some other gadgets such as a diathermy machine which helps in coagulating the tissue inside. and a recorder as well. So the robotic surgery works on the principle of master and slave technique. So the master has to give command so that the slave will work. It is a bit harsh to say it in that way, but that's how it works. This is the surgeon's console, where the surgeon will be sitting like this, and we have got various gadgets over here, just like a car's dashboard, and I would be able to manipulate the robot from this console. So this is called as the finger grip master control, which allows me to move the robotic arms very precisely. In the surgeon cart, there is a viewfinder. Now this viewfinder gives me a three-dimensional vision, which is almost 10 times magnified. Therefore, I can look inside patient's body with a magnified view, and even the smallest blood vessel or the nerves could be very easily picked up. Besides that, under my foot, there are 6 different pedals, and these pedals are used to move the camera forward, backward, as well as to use the cautery or a diathermy to coagulate the tissues. So this comprises the surgeon console, which allows me to use the robot in a completely precise way. Patients often ask us, how safe is this technology? How can a robot operate on me? And whether it is really effective way of doing a surgery? And the answer is very simple. The surgical robot has been there for the last 20 years now, and every day thousands of patients they get operated by a robot. But mind you, robot is not operating. As I said earlier, robot is just an interface between the surgeon and the patient. It is a master and slave technology. Unless surgeon is giving a command, the robot is not going to make a millimeter of a movement. It is extremely safe way. The efficacy of robotic surgery is equivalent to an open surgery, but definitely there are many advantages by having a robotic surgery than an open surgery. Therefore, there is no reason to get concerned about undergoing a robotic surgery, because it has been proven safe and effective.